Hi everyone, this is Dr. Mohan Raj Sharma, Professor and Head of Neurosurgery at the Institute of Medicine, Kathmandu, Nepal. In this video, I'll be discussing about the basic overview and introduction of research. This first slide deals with how we gain new information as human. The first and the most basic form is experience, next is reasoning, and third is research. Experience is the knowledge or practical wisdom we gain from what we have observed, encountered, or undergone. That is the experience. The negative aspect of experience is it takes a long time to gain, to learn new thing, and it is a very slow process. Next, better is reasoning, which is nothing but the capacity of consciously applying logic by drawing conclusions from new or existing information with the aim of seeking the truth. This is the example. If A equals B and B equals C, then A should equal C. Though most of the time this is true, but sometimes it may not be correct. And the most scientific way of gaining new information is, of course, research, which originates from the Middle French word rechercher, which means to go about seeking. And the research should fulfill this falsifiability and testability criteria. And research has two components: systematic investigation and generalizability. Systematic investigation means that there should be some methods applied in the process, and generalizable meaning the investigation aims to draw conclusions about people or practices beyond a specific individual. Research on human is most comprehensively defined by WHO as any social science, biomedical, behavioral, or epidemiological activity that entails systematic collection or analysis of data with the intent to generate new knowledge. And the US FDA considers clinical investigation as equivalent to human research. So if you do any data collection on human, it automatically becomes clinical investigation. Let's go to a brief brainstorming session as what happens when we all concentrate only on performing surgeries or seeing patient in the clinic and not participating in research. This was discussed by Professor André Grotinius from the Netherlands, and he has beautifully described the consequences. The first is we will become better and better in those surgeries that we perform more often, which is obvious. Patients and OR staff will admire you, will love you for your great surgical skill. High chance that you make more money because you are performing more surgery or seeing more patients, and highly likely that your colleagues will envy you. So it seems great, but we'll become nothing more than good craftsmen and technical expert, but we will not become scientists. Next is we will need other people with knowledge to tell us what we should do, and we'll be only a knowledge consumer, not a knowledge producer. And after going through so many academic colleges and going through the academic ranking, this is not a nice thing to be. And the worst of all, it will take us back to the Middle Ages, a barber surgeon. Dr. Robert Liston, he practiced in England in the 18th century, and he was considered as the fastest knife, and he has the record of performing leg amputation in 2.5 minutes. And in certain occasion, he wanted to be so fast that he chopped his assistant's finger off in one occasion. So a specific reason why we should conduct research at this, it is the most scientific method to understand the epidemiology of the disease, determine the utility and applicability of the diagnostic test, select best treatment modalities, and develop new tools and methodologies to measure and promote health equity. This is the paradox. The definition in developing countries, this is a ball with ketchup, and most of the hospital and also have their research center attached to their name where hardly any research is performed. So if you have if your hospital or center where you practice have a research center, then you should conduct some form of research there also. So what it should be the characteristic of research? WHO very emphatically says that there is only one type of research, good research. There is no such thing as bad research and good research. It if it is a research, it has to be good research. And these are the metrics by which we judge whether the research was performed adequately or not. The approach should be systematic, guided by standard rules and procedures. Research should be based on logical reasoning. Research should strive to create or set the stage for new hypotheses, and there should be an in-depth analysis of the data, plus the process should be correct. These are the characteristics, and every research, when you are on the way, or in the middle, or in the end of conducting research, you should ask, should go through these points and whether you have fulfilled this criteria or not. Different the research has been classified in a different way. The most common classifications are these: basic or applied research or translational research. Basic research is done in basic science areas, for example physiology, biochemistry, pathology, where the results of that research is not immediately useful, but in the long run very vital. Applied research is something which is immediately useful after the results are obtained. For example, use of antibiotic, whether one dose is sufficient as opposed to 3 doses or 5 days. These are the applied. And translation is sometimes you get information result from the basic science which you apply in clinical science, clinical setting, and after applying the results of that research in clinical setting, you again come up with some research question, and again you go back to basic science to prove or disprove that idea. Then it becomes a translational research. Action research is a type of applied research where the results are immediately useful. For example, COVID vaccine trial is a beautiful example of action research. And another way of classifying research is qualitative versus quantitative. This table, which I have taken from the Principle of Health Science Research, written by me, describes the differences, salient differences between quantitative and qualitative research. The basic difference is qualitative research focuses on exploring ideas, emotion, feeling, whereas quantitative research deals with numbers and tables and figures. There are research in special circumstances. One of that is dual use research, also called dual use research of concern. It is a type of research conducted for legitimate use but can potentially be exploited for harmful purposes and pose a threat to public health or national security. This is a dual use research of concern definition. The examples are these: research on toxins, pesticides, genetic sequencing, viruses, etc. Because of the very sensitive nature of these research, there are special regulatory requirement for conducting and monitoring this. Research in developing country, this is also one of the potential area where the discussions should be held. Many scientists from high-income countries consider low-income country as areas where there is a lot of scope for research, and also regulatory mechanisms are potentially perceived as lax. But there is if it is a collaborative research, then this is a win-win situation. But if it is a most of the time one-sided research where a person from high income country comes to low income country, performs surgery and takes the fruit back to high income country, that is not good and this should be discouraged. So as a person working in a low or middle income country, we have to ask this certain question. First is the proposed research responsive to the needs of the community? It should be yes. Second, does the proposed research involve the use of local resources, genetic, animal, plant? And you have to be very careful how they are going to use it, how they are going to, destroy the evidence after the conclusion of the research. That's number two. Number two, are there any post-research benefit to the research participant? And most of the time, there should be some form of benefit to the participant, so-called post-trial access thing. Fourth is the proposed research of benefit to local communities, capacity building, access to healthcare, education, etc. All these things should be addressed. And the fifth and the final one is, are local socio-cultural factors taken into consideration? This is also a very sensitive area in any research, no matter how great it is, which ignores the local socio-cultural factor should not be allowed to conduct. In summary, research refers to a systematic investigation designed to contribute to generalizable knowledge. In the modern era of evidence-based medicine, research is the most scientific way to generate new evidence. All research projects should conform to established standards of scientific methodology, and depending upon field and nature of the study or outcome characteristics, health research can be classified in many ways. This concludes my first video. In the next video, I'll be discussing about the history of medical research. Thank you very much for your patient watching.